Cigarette smoking is known to affect all the organ systems in the human body, causing numerous health problems. The harmful effects of smoking are primarily due to the chemicals and toxins tobacco smoke produces. Cigarette smoke contains various chemicals and compounds, including tar, nicotine, and poisonous gases, like carbon monoxide, nitrogen oxide, and other carcinogens which are absorbed into the bloodstream through the respiratory system. The tar from the cigarette smoke deposits in the mouth, on the teeth, gums, and the lungs. The lungs have tiny air sacs called alveoli. The alveoli are surrounded by a network of small blood vessels called capillaries. The alveoli are responsible for exchange of oxygen and carbon dioxide between the atmosphere and the human body. The chemicals and compounds in cigarette smoke, including nicotine, heavy metals, carbon monoxide, nitrogen oxide, and carcinogenic compounds, easily cross the lungs' membranes and are absorbed into the bloodstream through the alveoli. Once they get into the bloodstream, they distribute throughout the body. As more and more of these harmful substances accumulate in the body, they begin to damage the various body systems and organs, including the lungs, the heart, the blood vessels, the central nervous system, and the brain. Tobacco contains nicotine. Nicotine is the addictive component of tobacco, which stimulates the release of dopamine in the brain to produce pleasurable feeling. Constant exposure of the brain to nicotine from cigarette desensitizes the brain, leading to addiction, making smoking cessation difficult. Carcinogens in cigarette smoke can damage the DNA in cells. DNA is the genetic material that instructs cells to grow and divide in a controlled manner. Carcinogens in cigarette smoke can directly interact with the DNA in cells, causing damage or mutations and other genetic alterations. Cigarette smoking hinders the body's ability to repair damaged DNA. When DNA is damaged, cells can begin to divide uncontrollably. Leading to the formation of tumors that can be cancerous over time. Cigarette smoking is a risk factor for chronic inflammation. It is important to note that inflammation promotes rapid growth and survival of cancer cells. Cigarette smoking has been proven to be a major risk factor for many cancer diseases such as cancer of the lips, tongue, mouth, throat, and the esophagus or esophageal cancer. Other cancers associated with cigarette smoking include lung cancer, liver cancer, pancreatic cancer, bladder cancer, kidney cancer, breast cancer, cervical cancer, stomach cancer, colorectal cancer, and many more. The dangerous chemicals and toxins in cigarette smoke irritate and damage the lining of the airways, including the bronchial tubes and the cilia, causing inflammation and mucus buildup in the respiratory tract. The body produces excess mucus in an attempt to protect the airways. This excess mucus leads to persistent coughing to clear the airways, since the cilia, which helps to move mucus and foreign particles out of the airways, is destroyed. Cigarette smoking has a profound and detrimental effect on exchange of oxygen, O2, and carbon dioxide. Cigarette smoke contains carbon monoxide, CO. When you smoke, you inhale carbon monoxide. This enters the blood and binds to the hemoglobin in red blood cells, reducing oxygen uptake in the blood and the body. Smoking damages the alveoli. The alveoli is where oxygen is exchanged for carbon dioxide. This damage can lead to chronic obstructive pulmonary disease, COPD, a condition that causes a reduced ability to exhale carbon dioxide. This inhibits effective oxygen and carbon dioxide exchange in the body. Chronic obstructive pulmonary disease, COPD, includes chronic bronchitis and emphysema. Cardiovascular diseases, CVD, is another major health problems associated with cigarette smoking. Smoking can damage the inner lining or the endothelium of the blood vessels and trigger an inflammatory response. This inflammation leads to the accumulation of fatty deposits or atherosclerotic plaques in the arteries, narrowing and thickening them and reducing blood flow. Atherosclerosis is a key factor in the development of various cardiovascular conditions, such as high blood pressure, blood clots formation, stroke, ischemic heart attack, aortic aneurysms, and arrhythmias or irregular heartbeat. Cigarette smoking weakens the immune system, making the body more susceptible to infections and difficulty to recover quickly from illnesses. In women, smoking can reduce fertility and increase the risk of ectopic pregnancy, miscarriage, stillbirth, preterm birth, low birth weight, and sudden infant death syndrome. Smoking while breastfeeding exposes infants to nicotine and other harmful substances from the cigarette smoke through the breast milk, leading to irritability and restlessness in the baby, poor sleep patterns, increased heart rate and blood pressure. It can also alter the nutritional and protective value of breast milk and reduced breast milk supply in the mother. In men, smoking can reduce sperm quality, leading to fertility issues. Smoking is also associated with insulin resistance and an increased risk of developing type 2 diabetes. Smoking can reduce bone density, increasing the risk of osteoporosis and fractures. It also accelerates skin aging, leading to wrinkles and a dull complexion. Secondhand cigarette smoke is harmful to non-smokers as well. Exposure to secondhand cigarette smoke or passive smoking increases the risk of cardiovascular diseases and respiratory infections in non-smokers. Several decades of studies extensively proved the harmful effects of smoking on the various body systems and organs. It's important to note that quitting smoking is challenging. However, smoking cessation is crucial to improve the quality of your health and well-being. If you smoke and you are considering quitting, it's advisable to seek help from healthcare professionals, support groups, or smoking cessation programs to increase your chances of success. Thanks for watching.